Well, there has been a lot of talk about the flu this winter, but it's not the only virus people can get this time of year. Today in our monthly checkup, we're talking about the norovirus. New Hampshire State epidemiologist Dr. Benjamin Chan is here. We hear this a lot. And tell us what norovirus is.
Yes, so there's more circulating in the wintertime than just the flu. Norovirus is a very contagious virus that causes a gastroenteritis, and that just means it causes inflammation of the stomach and the intestines, which then leads to symptoms. And so most people who get norovirus begin by having some abdominal cramping, some nausea, oftentimes followed by vomiting and non-bloody diarrhea. Usually it comes on pretty quickly. People develop symptoms after about a day or two from being exposed to someone else, and then symptoms last anywhere from 2 to 3 days before resolving pretty quickly. It can cause dehydration, so people should be aware that more serious illness can result. The CDC, that's the Centers for Disease Control and Prevention, estimates that there's about 20 million cases of norovirus in the United States every year, so this is very common.
And how does one get infected with this, and is this something that we see in New Hampshire a lot?
Yeah, so people can get norovirus year-round, but it's more common in the winter months, so from about December through March or April. So we're in prime norovirus season right now, and it's usually spread by direct contact with someone or someone's infected body fluids, and for that reason it can cause outbreaks in crowded environments such as schools and daycares, cruise ships. We hear about this often, causing outbreaks on cruise ships. It can also cause contamination of food, and so the CDC estimates that about half of all food-related illnesses in the United States are due to norovirus. In New Hampshire, the majority of outbreaks that we get reported to us at the health department are outbreaks that occur in healthcare facilities like nursing homes, long-term care facilities. And so every year we have about 60 or 70 outbreaks of the gastrointestinal variety reported to us, the majority of which are norovirus.
And is there anything you can do to protect yourself from this or prevent norovirus from getting infected?
Yeah, so as I mentioned a couple times, it's very infectious.
Yes.
You know, you can get it from coming into direct contact with other people, infected surfaces, contaminated food. So people that have symptoms are usually infectious while they have symptoms and for up to a couple of days after symptoms resolve. So anybody that's sick needs to stay home from work or school. This is particularly important for healthcare workers, food safety workers, or food handlers and workers. You know, if somebody's sick, they shouldn't be preparing or handling food for others. If there's vomit and diarrhea, it needs to be cleaned up appropriately with like a bleach solution. And then just general good principles of frequent hand washing to prevent not only spread of norovirus, but other infections as well.
Thanks so much, Doctor, for joining us. We'll be right back.